After weeks of nearly no new locally transmitted cases, a new spike in infections rocked South Korea, mostly centered around nightclubs in the capital city, Seoul. And the country has been working very hard to stem a second wave. There are crucial questions, though, regarding fighting the pandemic in the next stage. How can we strike a balance, saving jobs and saving lives? For a closer look at these, I talked to Dr. Alice Hyun-Kyung Tan, an internist at MizMedi Women's Hospital and a frontline doctor from South Korea. Another thing I want to ask you really is about the tests that you're still doing about any people who are related to this cluster of outbreak. Now, how are you working with the other countries? After all, there was some kinds of travel ban, but still people were traveling at the time when the incident broke out. So particularly in the neighborhood country, China's Japan, for example, how is that being done, the communication part at least?
So anytime there is a imported case or a travel-related case, I think it's our Ministry of Foreign Affairs that makes sure that the information is passed on to the country from which the traveler arrived. However, there are certain regions such as Europe or the United States where they're not doing the extensive testing that we are. They're not doing the extensive tracking and tracing. And so even if we give them this information, it's very difficult for them to trace and then test the contacts. It's more done on an individual basis. And I've heard cases actually of, for example, I know of a young gentleman who came from the UK. He tested positive. He was in quarantine. He contacted all of his roommates and friends, and they had a very hard time getting tested, even though they were close contacts. And so the Ministry of Foreign Affairs is working on this, and we are trying to inform not just our neighboring countries, but we're seeing an increase of cases from actually Africa, Tanzania, from the Middle East, especially Kuwait. And so we're working on trying to get some degree of cooperation, obviously, between our countries so that the information regarding positive cases is given very freely.
How would you compare PCR tests and also antibody tests from your perspective?
So they both have certain roles to play. The antibody test lets you know if you had COVID-19 sometime in the past, but it doesn't tell you when. The PCR antigen test lets you know if you had a recent infection or you're currently infected, say if you've never had a history of COVID-19 before. If you do a combination of the two, it can give some information in terms of where on the clinical course, say, for example, an asymptomatic patient, where in the clinical course this patient is, because antibodies are formed later on in the infection, whereas, of course, antigens are produced very early on. And so I think each test has its own role. Antibody testing can be used, as I said, in communities, in populations, just to see how many asymptomatic patients were there in the past, or, you know, maybe people had slight symptoms but didn't suspect COVID-19, didn't get tested for COVID-19. But if we check for antibodies, then we can know, oh, maybe there was a 2% prevalence or maybe a higher prevalence of COVID-19 that we just didn't know about. So they both have important roles going forward.
There are countries around the world, even some very developed economies, that have been promising to have tests as much as possible, but still would not be able to implement that. With those cases in mind, Dr. Tan, do you have any advice for them?
Fast, accurate, widespread testing is an essential pillar to managing COVID-19. Countries that have very robust public health systems in place, I think, do better. Countries that are making the test either free or very low cost are doing better. Countries that can produce the test kits domestically are also doing better. And countries that recognize the importance of testing. I mean, some countries are denying it, but countries that recognize the importance of testing are also doing better. And then going on to the next phase, because many countries are still, when you start to open your economy, you need that capability to test potential cases to know where the disease is going. Is it trending upwards? Is it trending downwards? Without testing capacity, there's no way of knowing.
Dr. Tan, there are a lot of unknowns about this virus still today. There are a lot of things that we don't know as to what this virus eventually would cause and what might be the mutation of the virus, and as a result of that, what does it mean for individuals, for the societies? So Dr. Tan, will testing be able to help us, at least in the most basic way, some of the most important points that we don't want to miss?
There can be mutations. We're checking for mutations at least once a week to see, if the PCR test, to say if there's a significant mutation that's going to make the PCR test invalid, we want to know about it. Up until now, that's not been the case.
How you've been trying to link the mutation with the PCR test accuracy? I think this is a fascinating thing that we want to hear about.
So there are certain fragments of the virus, of the virus's genome, that the PCR test is checking for. And if within that specific fragment there has been a significant mutation such that the PCR test can no longer pick up the virus, then it would make that test moot. But that has not been the case. Now, going forward, we're all in the stages of developing a vaccine. Mutation of the virus is going to be important in terms of vaccine development as well. And of course, this is what happens every year with influenza. We get mutations, and that's why we need a yearly new influenza virus. We don't know if that's going to be the case for COVID-19. We hope that the viruses that are in development now, the vaccines that are in development now will match the viruses that are the COVID-19 virus that's in circulation. So yes, there are a lot of things that we still don't know about the virus. One concerning aspect is a hypersensitivity, a hyperimmune. We had been thinking up until now that COVID-19 is fairly benign, the pediatric population. But now that these cases have been reported in the US, in the UK, in Europe, this is quite alarming. And Korean schools have not opened yet. They were supposed to open today, but because of the new cluster from Itaewon, the opening of schools has been delayed by a week. But a lot of people are worried. We don't know the full spectrum of the behavior of COVID-19 in the pediatric population.